Hey everybody, it's Dr. Eric Balcavage. We're back for another edition of Thyroid Thursday. Today we want to talk about hypothyroidism and dry skin. Is there a link? There absolutely is. Thyroid hormone plays a role in almost every aspect of skin physiology. So you have to have appropriate thyroid hormone physiology at the cells of the skin to have healthy skin. So let's back up. Let's just talk about hypothyroidism. Remember, there's two types of hypothyroidism. There's glandular hypothyroidism, which means the thyroid gland is not making sufficient thyroid hormone. The primary cause of that's Hashimoto's in the US, but there's a number of other issues that can cause the gland to not produce enough thyroid hormone. And then there's cellular hypothyroidism, which means the thyroid gland is healthy, it's fine, it's making enough T4 and T3, but once that T4 and T3 gets to the cellular level, it's either not getting into the cell or it's being deactivated at the cell, and that's driving hypothyroid symptoms. So anybody that's got glandular hypothyroidism is probably going to have cellular hypothyroidism, but you can have cellular hypothyroidism and have a normally functioning gland. Okay, that's important. So I already said the thyroid hormone plays a role in almost every aspect of skin physiology. And when you have hypothyroidism that's driven, that's causing skin issues, we're typically going to see rough, dry, itchy skin. And we're going to see the skin can turn actually more of a pale color, and it can also get a yellow hue to it. Okay, so those are some of the key symptoms to look for in hypothyroidism-based skin disorders. Why do we get dry skin? Well, if you think about what's at the root of most cellular hypothyroidism and even glandular issues, there's some type of cell stress. And when a cell is stressed, what happens is the normal metabolism of the cell to grow new cells and new tissues and to all about the growth and regeneration of cellular health, that stuff kind of gets shut down. Energy production gets shut down, and really thyroid hormone gets shifted within the cell, within the tissue, and within the organ itself to focus on cell defense. So make more inflammatory chemicals, make more inflammatory proteins to upregulate the immune system to try and kill the threat. So under times of cell danger or cell stress, things like hair physiology and skin physiology and hormones, they're not nearly as important as cell protection. So if you're struggling with some type of chronic hypothyroid condition, whether it's glandular or cellular, you got to get to the root of whatever's causing your cell stress. So we often see people who have hypothyroidism and have dry skin have other autoimmune disorders, and some of those other autoimmune disorders that affect the skin. We can see things like vitiligo, alopecia, dermatitis herpetiformis, eczema, psoriasis, lupus, scleroderma, and even urticaria. Why would somebody who has Hashimoto's develop these other autoimmune skin conditions? Well, remember, if you don't get to the root cause of your first autoimmune condition, you could develop other autoimmune conditions. And the skin is a big organ. We typically see people who have, especially gutty issues, start to develop skin issues, either autoimmune or non-autoimmune types of skin conditions. So what can you do? I mean, what should you do if you have chronically dry skin? Well, one of those things that you can easily do, you don't need anybody to do it, is just get some good products to put on the skin to protect it, to take the itch away. A lot of people buy expensive creams and lotions, and you really don't need that stuff. Probably the easiest thing to do is use something like olive oil, avocado oil, jojoba oil, even coconut oil, and just rub it onto the skin, onto those dry areas of the skin, and that'll help lubricate and protect that area. It's not a long-term solution, but it can definitely make you a little bit more comfortable. Once that oil's been on the skin for a while, make sure you wipe it off. Try not to use alcohol-based oils, because those alcohol-based oils can actually burn and dry the skin out, so you don't want to use those. You can use things like parent essential oils. The skin has a high level of omega-6, unadulterated omega-6s in the skin. I think it's 20-to-1 of omega-6 to omega-3 in the skin. So parent essential oils, whether from plants or animal products, can be helpful and beneficial. And then the last thing to do is, get a good comprehensive metabolic panel and a good comprehensive thyroid panel, and have your functional medicine doctor interpret it. And when I mean interpret it, I mean not just look for highs and lows, but actually look at the lab work and interpret whether a normal value is appropriate, or if you have abnormal values, what those abnormal values tell us about you, so we can get some clues as to whether you have primary hypothyroidism, do you have cellular hypothyroidism, and what might be causing it, okay? Hopefully that helps. If you're struggling with chronic dry skin, use some of the oil to try and lubricate it, and then work with your functional medicine doctor to get to the root cause of your cellular hypothyroidism and your dry skin. All right? Take care. Have a great day.